One. Should be good.
All right, I guess, am I taking over, Michelle? Are you going?
Go for it, sister. Go for it.
Hey guys, so welcome tonight. So excited to be here, and we're talking about I See Bright tonight, and I have the extreme pleasure of introducing Miss Judy Jackson Hughes. So Judy is someone who's on my team, and she's a doctor of optometry, and she attended the New England College of Optometry in Boston, and she said she graduated in 1995 with highest honors. Of course, Judy. And she said she had been practicing ophthalmology for the last 27 years. And she said that her daughter was born when she was actually in school, and she became interested in visual development. And she spent 17 years helping children and providing vision therapy services to promote visual development. So, Judy, I didn't know that. That's so awesome.
Yeah. Kind of a little specialty area.
Oh, it's so good. It tags right on to what Dr. Leverett did this morning, right? Amazing.
Right.
So for the last 10 years, she's been providing primary care optometry service to all ages. And she worked today and has put in a full day. And, you know, a lot of clinics aren't open on Saturday, so that's really exciting. So Judy, we're super excited that you're here, and we're not going to waste any time. We're going to just turn it right over to you, and so excited to learn from you. So take it away.
Okay. Well, thank you so much for inviting me to be here. Wouldn't you know it, my dogs just pushed the door open and came in. Oh, well. So tonight we're going to talk about eye health, and I've been working all day. I still got my scrubs on, so I really have all this floating around in my brain. I don't have a formal talk, just going to kind of talk off the top of my head. But the star of the show tonight is this little guy right here, I See Bright. And I tell you, I joined LifeVantage because of this protandem NRF2 that reduces oxidative stress in your body and in your eyes. This is so powerful, you guys. Glutathione is one of the main oxidative stress reducers in the eye, and this raises glutathione by 300%. So that got my attention. This is huge. So I was happy to have this. But when I was sitting at convention 1 year ago, and my jaw dropped, and when they announced that they were releasing an eye vitamin, I just couldn't believe it. I just sat there in shock. I was so beyond happy. I'm like, I just can't believe that this is happening. So this, I have spent the last year recommending this, along with the NRF2 and some other things I'm going to sprinkle in there, because all of these things just kind of work in tandem to help keep your eyes healthy. But one of the main concepts I want to introduce is that, you guys, your eyes do not exist independently of the rest of your body. They are part of your body, and whatever your health is systemically, you are going to see that in the eyes. So you can't just take, don't think that you can have healthy eyes without being healthy yourself, okay? So that's a big paradigm shift for a lot of people. So we've got the I See Bright vitamin. I'm gonna talk about that first because that's kind of the main topic for tonight. And so before, we always recommended eye vitamins to the elderly who were at risk for macular degeneration. And that was very common. And we have the AREDS and AREDS2 studies that supported that nutraceuticals did help slow down the progression of macular degeneration. And so, but now when this eye vitamin came out, this one is formulated for all ages. And that is a big difference, because now we have computers. You know, I don't know, back in the day, like 10, 15 years ago, we called it computer vision syndrome because we didn't really know what was happening at that time, but we knew that we had people coming in now with these new symptoms of eye fatigue and eye pain and, you know, headaches, and, you know, they were just really struggling. Well, now we understand it more. And so this eye vitamin was developed to help us and to support modern eyes who are on the computer all the time doing near work, and so that we will have less fatigue, less headaches, less dryness, and just be able to function better. Because our eyes were not made to get on the computer and do this kind of work all day. Okay, so we have a lot of components in here. I feel like this vitamin has just a more comprehensive group of components that really kind of combat things in a lot of different areas. Okay, we do have the lutein and zeaxanthin, which is so important. These are the macular pigments, the carotenoids. They're powerful antioxidants, but they also make up the area of the macula that has yellow pigment. Okay, and that is our natural way of absorbing the blue light. Our body has a system to do that. That's cool, but you know, that's not the only thing that the macular pigment is there to do, but it is a way for our body to absorb ultraviolet and blue light. But we also want to, because we know now that blue light has a lot, you know, shorter wavelength, it has a lot of energy, and it takes a lot of energy for our eyes to focus that light. So by wearing the blue blocker glasses and by taking the eye vitamins and beefing up that area, you're really going to help your eyes be able to maintain their comfort and health throughout your lifetime. So this is good for all the 20-somethings that come in for eye exams, you know, all the way up through the 80-year-olds. All ages can benefit from this I-C Bright. So the lutein and zeaxanthin are in there. We've got vitamin C. Vitamin C is such a powerful antioxidant. It's great for the eyes. We know that we need vitamin C to promote collagen building. And so it's a really important part of, you know, health of the eyes is vitamin C. And then we have omega-3s. It's in the form of cod liver oil in here, which is so neat because did y'all know that cod liver oil is the best form for the eyes to get the omegas, and because it also has vitamin A in there and some vitamin D. And so that I was really surprised to see that they did put the cod liver oil in. That's great for the eyes. Zinc and copper help for the nerve transmission because your eyes are part of your brain. And the photoreceptors, the rods and the cones, remember that from biology, they are neural fibers. Photoreceptors, okay, and they're stimulated by light, but they actually go through the optic nerve and back here to the visual cortex where the images are actually formed. And so our eyes are part of our brain, and so the zinc and copper help with nerve transmission. Anything that is good for the eyes is also going to be good for the brain, and vice versa. Okay, so they're so interrelated. We've got bilberry in here, which is one of the old, I mean, it's been around forever and is well known to help the eyes reduce fatigue and to help really with contrast sensitivity, which helps you see better at night. And so that is, you know, they just put it all in here. It's really, really neat. And I've had people telling me that it's helped their floaters, and I have personally experienced that myself. I can still find them if I'm in just the right light, but they're so much more dim, and you know, I have to kind of look for them now. They're not just in my face. Do y'all have floaters? Anyway, so this helps in a lot of different areas. I love this eye vitamin. I recommend it to people all day, every day. But I love it together with the protandim NRS2. Like I said, this is so important for the eyes because glutathione is the main antioxidant enzyme in the eyes. Even in the lens of the eye, those early changes where we have trouble seeing up close, those are it's oxidation of the lens. And glutathione is the main thing in the lens to help prevent that to happen. So this is huge. And then of course omegas. We got to take our omegas for our eyes and our brain, and every cell in our body needs omegas. So important. And then now, guess what, y'all? The collagen, it's so important for the eyes too. And I've been doing my research. We've got collagen in the lens of the eye, in the cornea of the eye. We've got all collagen in the retina and the sclera, the white part of the eyes. So now this is becoming one of the things that I recommend to my patients. So we've got all this goodness. I'm so excited. I just love it. So did anybody have any questions, or can I answer anything for anybody? Can't hear you.
My bad. Thank you. I was going to say, Dr. Judy, that was just so amazing. I just so appreciate not only, as Troy said earlier today, the why behind everybody's having all these results, but I just can't get enough of your passion and your excitement and your belief and just, right, like everybody needs this. And I love learning so much how the eye is connected to the brain. I was saying earlier, my eye doctor as well here in Sioux Falls was so excited when she saw this product come out. And she too, years ago when I first shared and I asked her, is oxidative stress bad for the eye? And she goes, oh yes, glaucoma, macular degeneration, cataracts, all that, and with animals as well. And so when I said, can you believe that there's research in PubMed.gov that shows that this lowers that oxidative stress by an average of 40% in 30 days and up to 70% after 3 months? She was like, no way, where? Show me. And then she saw it, and then same as you, just got so excited and saw these ingredients. And one of the first things that she did say to me, and now it makes sense, knowing how everything's connected right to the eye, is just how big this is as well to the brain. It's just so powerful. So
it's phenomenal. And back in the day, we just monitor people's eyes every year, and they would just get worse and worse and worse every year as people were getting older. But we really didn't have any way to be proactive and to help slow everything down and to keep them healthier longer. And now we have all these fantastic tools. So, it is very exciting.
It's incredible how when you activate your body, activation can just get things going. And I know your dear friend, Leslie, if you want to share, and we're going to share a couple of testimonies, Dr. Judy, if that's okay with you. And as they're sharing, if you're like, oh my gosh, this is why, and you want to interrupt or interject or explain even further for all of us to really understand and to continue to build our belief, please do. Because I know Leslie, she had really dry eyes in the past. Leslie, you want to share kind of what's happened for you?
Yeah, and Judy, I want to thank you for just like digging into the individual ingredients, because this side of the presentation has been so different from what Dr. Leverett did this morning. She dug into the anatomy and the why, and like knowing just the individual ingredients and having that's so great. I just love it so much. So thank you for that. Sure. But I had dry eye, and to make a long story short, because I talked about this morning, I was not tolerating my contacts. So my eye doctor said, we need to do at this point, you really need to have LASIK surgery. And he said, I want to forewarn you that there's a possibility that there's 1% of the people that have LASIK surgery that their dry eye gets worse. Well, that happened to me. So
you're the lucky one.
Yeah, I was really lucky. So it was really unfortunate, because I honestly, it's been great not having to deal with contacts, but I really did struggle, and I still had astigmatism in this eye, which was one of the main reasons why I wanted to get LASIK surgery. And, even then I still struggled. So, and when I say I struggled, I had LASIK probably 4 or 5 years ago. So even up until just last year, I was still using drops, and they were literally everywhere. I had them everywhere, in the car, in my purse, in the bedroom, in the bathroom. Like, I didn't want to have to walk anywhere to find them. So I just scattered them out in little dishes all around the house. So, they really weren't doing a great job. I did the prescription. I did Xiidra. We tried Restasis. We did Patanol. We did Pat-a-day. I did them all, and some of them were super expensive. And it just wasn't cutting the butter. And last year, about this time, we came out with I See Bright. I started it I put a testimonial. I went back and read it today in Vitality Living. 12 days in, I noticed significant difference. And a year later, it's even better. And I will say, Judy, adding collagen in, I was in the test group for collagen in May, that was the nail in the coffin for me. Like, I don't use drops at all anymore. I don't even have to buy them. So it is it is life-changing for me, because if you've ever had dry eye, you do know that it also affects your vision. So having astigmatism makes things look blurry anyway. But when your eye's that dry, it blurs the vision, and it
It
feels
does.
like there's sandpaper in your eye. It's really horrible. So it is truly a game changer, like to not be able to, you're blinking and looking and putting the drops in to try to clear everything up, and then like 10 minutes later you're right back to where you started with the drops, which is really, really frustrating. So
Mhm.
game changer for me.
Yeah, and dry eye has a big inflammatory component. And so by reducing that oxidative stress, it does really help dry eye. And I can tell you, not every single day somebody comes in with dry eyes. It's very common. And so there's a lot of people that can be helped
Yeah,
by this.
it's
Mm,
a great combo.
Hmm.
huge combo. And that's another thing too with, Protandim NRF2, we have US patents and international patents that show that we lower inflammation in the body. So I don't know, Dr. Judy, in regards to the eyes and all that, but I would imagine a big deal as well. Right with it. Cool. Troy Logie, do you have a few moments here? Troy is from Sioux Falls, South Dakota, and he too, I mean, just hearing his story, you just want to get this out to as many people as possible when you hear these stories. Because like you said, Dr. Judy, so many people have dry eye, but then the things that Troy's going to share too, my mind was spinning today when I was hearing this again.
So first, I want to really say, Dr. Judy, last year's Global, Shauna and I sat next to you at a dinner after,
Oh, it's dinner.
and I remember speaking to you, and you were excited but apprehensive. You were medically looking at this saying, I think it'll work. So for seeing this passion in you, like now, versus your apprehension and wanting to go back and study it and look at it, and now you've tested it on patients, that's huge for me and my excitement, just seeing that, because it was very interesting. And I get you were just wanting to make sure that this was going to work. And
Absolutely. As a healthcare professional, you've got to be really careful what you're
yeah,
recommending. Yep. And so it's all proven to be just very legit.
so that's exciting for me. But I have my own story, so
Yeah, let's hear it.
my wife Shauna and I have been activated for a while, and she's always had us on a collagen, but now we're on LifeVantage collagens, of course. But after Global last year, we were talking, have you noticed anything? What do you think? And then we were driving to my nephew Tyus's football game in St. Louis, and we were just driving, and just out of the blue, I'm like, holy buckets, everything is so clear. I had such amazing clarity that it was like I couldn't stop talking about it. Like I was telling Shauna, the leaves on the trees, I could see the details driving down the interstate of all the leaves. And prior to that, I never wore glasses permanently or contacts, but I would have to wear the driving glasses and like sporting events at night. Night was terrible, like very starred. And if it was raining at night, it was not a lot of fun. And so I don't have any of that now. I don't have to wear any night glasses. I don't wear any glasses. And actually the last time I went to my eye doctor, I know I was telling Shauna this when I got done, my eyesight was better looking at reading the little things that you read. He's like, I don't know what's going on, but you don't even need a prescription for the games or the night times anymore. So that was pretty incredible for me. My own story with that, and I will say that let's see, it's my retinal receptors are killing it. That's what's happening.
All right.
And their floaters are gone. I used to see those little amoebas floating by, and you'd follow them, right? You could follow them across your eye. I haven't seen one of those suckers in a long time.
So annoying.
I'm like so excited that I don't have to wear anything when I'm watching football games, basketball games, driving at night, or anything like that. So, and then your passion from last year to now really confirms it also. So thank you for what you've given us tonight.
You're welcome. My pleasure. You're with your vision getting a little clearer. As the retina is functioning better. I mean, your retina can be seeing, but not be functioning at a very high level. And then you'll see stuff, but it just doesn't look crisp. It doesn't look clear. It looks kind of faded. And so, and then as it starts to function better and better, that just, you can tell, and you get better contrast sensitivity, and it just looks better. It's easier to see.
Exactly what he's saying, those gorgeous leaves driving. And what a gift. I mean, how beautiful to be able to see more clearly the gifts of our life, right? And yeah, anyway, Shauna, I don't know if there was anything that you wanted to say, but I'm so happy to see you here. Was there anything that you wanted to add to Troy, or anything with yourself?
Sure, I'll add. So for me, and I remember that trip so well. And it's crazy how when you have like an epiphany like that you always remember that. So we'll forever remember that trip to Tyus's game because of that. But for me, it was like 7 to 10 days in after I See Bright. I said to Troy, I said, this is crazy, Troy, because I had been kind of complaining that my eyes were so sore and maybe I need to get to the eye doctor. And I finally figured it out. It was because I was spending so much time on my laptop doing so much research. I literally would have to close my laptop because my eyes would get so sore, and I'd give them a break. But like 7 to 10 days in after I See Bright, it just wasn't there. It just wasn't there. And it was such a big change that's the only thing that I can attribute it to. So I would say that was my epiphany with I See Bright, and I'm looking forward to go to the eye doctor here at my next checkup, because I feel like my eyes, like when I have my regular glasses on, my eyes have felt a little achy, and I don't know if my prescription has maybe changed. So we'll find out at my next appointment, but that was a biggie for me with I See Bright.
Good.
Amazing. And we have seen this, and I don't know, Mary, if it's happened to you or not, I don't remember, but people's eyes, it's so fascinating what our bodies are capable of, right? When we have these things, we don't know that it can get better or improve even with age, but we have seen people's eyes get better, or their prescriptions get lightened up by quite a bit. It's so interesting to see it with nearsighted and farsighted people. So thank you, Shauna, so much. Miss Mary, you there, sister? So we have Mary Dippold here. Would love for you to share your story, if you could, please.
Hello, everyone. My activation journey began back in 2014, and that changed my life dramatically. Yes, it brings tears to my eyes. I just want you to know that it began way back then. And because of what it did for me, just the little yellow pill, I was set to use every product that LifeVantage came out with. I was going to give everything a try just because of what the dramatic change I had with just the activation. So my eyesight journey, health journey improving began. I can't let NAD out. I have to share NAD. In 2019, in the summer of 2019 is when NAD came out. I had just had a doctor's appointment, and he checked my eyes and prescribed me contact. I wear contacts all the time, and I have since 7th grade. Prescribed me a contact lens. I got worse, they got worse, and bought new glasses, the trifocal glasses, spent all that money on the trifocals. Well, 6 months later, I couldn't see very well with my contacts, and I was getting a little bit concerned. I had started the NAD as soon as it came out, and I thought, okay, I'm just really not liking this, but I'm going to continue on. Well, then that's when COVID came. And that spring, I wasn't working, I was home, and I realized that I was leaving the house without putting my contacts in because I didn't need them. I didn't put them in the first place. And so then I had my follow-up year's doctor's appointment, and I had him check my eyes. And of course, he asked how I was doing, and I said, really not well at all. And he was concerned, and he checked him, and he said, and when a doctor goes, you don't know which way he's going, about. And he says, we have to do some further background checking. And I said, what are you looking for? And he said, do you think you're diabetic? And I said, no. He said, well, I need proof on that, because he was concerned that when he had checked my eyes a year ago, that my blood sugars were high, and that was offsetting the actual prescription that he had ordered for me. And so I had to call my doctor, and I got all my 4 or 5 years visits, blood sugars results to him. And he says, no, you're not a diabetic. And I said, I told you I wasn't. I know I'm not. And so I said, I know what has happened. You're saying my eyes have gotten better. And he says, I have never seen it get that much better. And I said, I know what it is. And that's when I shared with him. And he understood it all, but I don't think he fully grasped it. But nonetheless, my eyes continued to improve. But when IC Bright came out, that's when I noticed the floaters. The floater issue was gone. The other thing I really noticed, and Dr. Judy, you can maybe explain this, but the color red became very vibrant to me, especially with cars. As a car was riding by, I thought, oh my gosh, I really like that color red. And I have never noticed that color before. Other colors became vibrant, but that's the one that stood out to me. The other thing is the glow, around the headlights, the oncoming headlights. That is not an issue at all. I'm not saying it's totally gone, but it's definitely not an issue. So to back up, I have to back up. I just thought of this too. I went back to my doctor a year and a half later, and I said, this prescription is still not good for me. And he checks them and he goes, well, they've even gotten better yet. So he prescribed more contacts. And I said, nope, I can't do that. And so I am to the point that I only wear one contact, because when he gave me the other one, it just offset it a little bit too much. I couldn't do my fine reading. I mean, I can read with that one contact, quite small. And I was a cheater person. I had cheaters like you had eye drops, Leslie, in every room. I had cheaters in every room because you just didn't know when you were going to read. I don't have cheaters at all anymore. And so I'm a one contact lady once that IC Bright came about. And, I have just decided to put a lot of faith, hope, and trust. Number one, God delivered this product into my body, the activation, when I needed it. And I have just seen with absolutely every product some form of improvement in my body, in my health. And so I love the fact that and if I don't go away, I don't even wear a contact. I don't even put one in. If I'm in the house, I'm fine. I can see TV. I can do everything without it. But if I leave the house and I drive, then I do put it in. So that's my story.
Dr. Judy, you're muted.
I had to mute because my dogs were making noise.
Mine too.
As your health becomes better, as your blood sugar levels became better, and all this, and then by nourishing your eyes with the IC Bright and being activated, and all these things are just coming together just to give you that great eye function that you should have, so that's a wonderful story.
Thank you.
Oh, so amazing. The vibrant reds and the colors, and just being excited about seeing them and what that did for you, just the joy factor in your life, Mary. Right?
Yes. And I remember saying that to Amy all the time. I said, Amy, isn't that a new color car out? She'd go, no, it's not. It is to me.
Wow. That is incredible. Thank you so much. Is there anybody else here that's on Zoom that wanted to share a personal story, or somebody, that you know of, or a loved one? I know these were the ones that we knew for sure we're going to be sharing. So just type in the chat or unmute yourself. But wow.
And so, Michelle, so I guess I wanted to ask Judy too. So I'm assuming too that with IC Bright, that the results are going to be cumulative, just like they are with NRF2. The longer that you're on it, the better the results should be. And you should start to notice more and more things, right? Because as you're getting rid of that inflammation, and because I'm a year in now with IC Bright, we should continue to see improvement as things go. So we may notice new things in a year, right?
Absolutely. You might see their biggest changes, you know, up front, but as you go along, it will continue to change. And you know, the Icy Bright, it's not just helping your eyes, it's helping other things too. So it's something that you definitely want to continue to take. I mean, the environment, I mean, it's just that everything takes such a toll on the eyes. They need all the love they can get. So especially as you get older. So you just want to keep taking it, definitely.
So good.
Incredible. Well, Dr. Judy, thank you again. And do you have any last words that you want to offer up anybody before we end this?
Just work on your health, everybody. It's going to help your eyes. It's going to help everything, you know, to get that sugar out of your diet and all the inflammatory foods. At least walk, and then support your body with the activators and the, you know, the good quality nutraceuticals that are really going to support you and help you be healthy, especially as you get older.
Amen. You have control. You literally have control, and your body can do incredible things. There is a pharmacy within this body, and once it gets activated and has what it needs, incredible things happen. And these stories matter. So for those of you that are out there watching, you know, in the chats and all that, please put your stories there. And I tell you what, my heart is filled up to the brim from these stories tonight, and from listening and learning so much again from you, Dr. Judy. Thank you so much. And as Shauna was just doing, we're sending love to all of you. Thank you, thank you, thank you. And get back to the person that invited you here tonight. Let them know that you're ready to get this and learn more about our other activating products that are so important to your body and in every aspect. So thank you. Have a wonderful, is it Saturday evening? All right. Good night, everybody.
Bye-bye.
Love you. Good night.